You're listening to Nutrition Matters Podcast with Paige Smathers, registered dietitian nutritionist.
Hi everyone, it's Paige Smathers. Thanks so much for being here. Nutrition Matters Podcast explores what really matters in nutrition and health with a sensitive and realistic approach. To help support the podcast, please consider making a donation at positive-nutrition.com/podcast. If you find this episode interesting, engaging, or helpful in your life, please consider donating, sharing with friends and family, and leaving a review on iTunes, Stitcher, Google Play, whatever podcast app you use to listen to this podcast. You can leave a review about this podcast straight from your podcast app. Search Nutrition Matters Podcast, click reviews, and then write a review. You can also find me on Instagram and Facebook if you'd like to have a little more food for thought. Thank you for listening. Hi, everyone, and welcome to Nutrition Matters Podcast. My name is Paige, and I'm your host, and I'm so grateful that you're here today to talk with me and my guest, Robyn Nohling, who is a registered dietitian and also a nurse practitioner. She is known on social media as the Real Life RD, and today we're sharing a conversation we had all about hormones. And I'm really excited to share this with you because it's something that I think is very relevant in today's world, and also just in conversations about health and about self-care, about disordered eating, about healthy, balanced, positive self-care, all of that stuff. This is just really relevant to talk about kind of helping us decide what's fact and what's fiction when we're navigating all of the health information we're taking in. And I couldn't think of a better person to talk to and to dive into this topic with than Robyn. So Robyn lives in Boston, Massachusetts, and she recently moved from New York City. So she has her own experience with walking her own health journey with disordered eating, amenorrhea, and hypothyroidism. So her own story has been the catalyst to her career, which is focusing on counseling, nursing, mentoring, and teaching in the field of women's health and eating disorders. She's a board-certified family nurse practitioner and registered dietitian. She specializes in hormone and reproductive health, along with eating disorders and disordered eating. She uses a weight-inclusive and non-diet approach and believes that health goes far beyond your plate and exercise routine. And we talk about that a lot in this episode. So alongside her private practice, her blog and inpatient nurse practitioner position, Robyn also launched an online learning center in 2017 to both educate other practitioners and to empower women to advocate for their own health and healing. You're going to love this conversation I had with her. I think this is just a really, really important conversation, and I'm so glad you're here. As always, really quick, I am making a renewed effort to be more present in the podcast group. So if you're interested in joining us over on Facebook, I'll be popping in regularly. I want it to feel like a community. I want it to feel like a safe place to discuss and comment and explore beyond the podcast. So join us there. It's Nutrition Matters Podcast Community on Facebook. Also, feel free to follow me, my practice on Facebook as well. So you'll find me Positive Nutrition with Paige Smathers RDN on Facebook. And then on Instagram, I'm at Paige Smathers RD. And super excited about the workshop coming up in June. I hope you're not too sick of me mentioning that. It's on June 23rd. This workshop is open to anyone who wants to come. Registered dietitians will be eligible to receive 6 continuing education credits. It's a day full of learning, all about mindfulness and about how mindfulness can help enhance our relationship with food and ourselves in general. And we just loved it so much the last time we put it on. It was a huge success. I know I learned a bunch, and it was great. So check that out. See if it might be something you could make it to. Go to positive-nutrition.com/workshop. And then I also wanted to just give a little shout out to all of you, those of you who have been able to leave a review for the podcast. It's super helpful on lots of different levels. Thank you so much for taking the time to do that. And just want to also let all of you know that my new dietitian who's working with me, Katie Davis, who, if you missed last week's episode, we dove deep into her story, and you can kind of get to know her there. Katie is taking on new clients. So if you're local in Salt Lake City and want to work with someone, she's available. Also, if you are at a distance, we can talk about whether or not distance coaching could be a good fit for you. And Katie is always really open to being emailed or to taking a phone call. So if you want to get in touch with Katie directly, her phone number is 385-831-1709, and her email is katie@positive-nutrition.com. So reach out if you're interested. And thanks everyone so much for always being so supportive and kind and willing to dialogue on and off the air. I appreciate it, and it's such a fun kind of energy I hope we've built around these topics that can be really emotional and really stressful. And this one included, the topic of hormones is definitely fraught with a lot of emotions and a lot of things. So thank you so much for being willing to engage in these conversations and learn and grow together. I know I really appreciate it, and I benefit from it so much myself. So anyway, thanks again for being here, and I hope you enjoy this podcast episode with Robyn Nohling. Hi, Robyn. Welcome to Nutrition Matters Podcast, and thank you so much for being here.
Hey, Paige. Thanks so much for having me. I'm excited.
Yay. So am I. I've been looking forward to this for a long time. We finally got to hang out in real life a couple months ago, and that was so fun. I just had the best time.
The best.
So great.
Best.
Dietitians unite.
I love it when your online friends become real life friends, which is always fantastic.
It's like, oh yeah, that is a real person. It's kind of like cool to remember that.
Oh, totally. She exists.
Oh, well, cool. So a lot of my listeners might already know you, but just take a minute to talk about what you do and kind of start broad, and then we'll zoom in and focus on a few things.
Yeah. So I have tried multiple times to make this as concise as possible, so I'm going to make another attempt here. So I am Robyn Nohling. Some people might know me as Robyn Cole, but I am a registered dietitian first and then a nurse practitioner second. And I currently have a private practice. I am based out of Boston, used to be based out of New York City up until January, and now live in Boston and work in private practice with another dietitian and a therapist that I also have working with me, a couple interns. And then I also work at an inpatient eating disorder treatment center, working more on the medical side of things as a nurse practitioner. So kind of over time, I've worked in a lot of different roles as an NP. I started off in more emergency medicine and urgent care, then moved into primary care, and then moved into mainly eating disorder care. And then I've kind of stuck there. I've always done eating disorders and women's health, some elements of disordered eating in private practice. But I will say, I mean, probably similar to many people that have been on the podcast, that my professional philosophy has certainly changed over time. I never really actually thought I would go into eating disorders. I always knew I loved working with women. But I was really passionate about metabolism and getting women to eat more and not diet and really take care of their bodies. And obviously dialoguing through that, and blogging about that, you're going to probably attract a following that struggles with eating disorders or disordered eating. And I started working mainly with women with those patterns and completely fell in love with the work. So that is where I am now. And I truly feel like this is my path. So that's kind of the broad picture. Do you want me to back up into steps of how I got there, Paige?
So that's great. And I just wanted to make the comment too, some of my listeners might know, but I totally have a similar experience where I told myself in college, like, there's no way I would ever work with eating disorders. It scared me, and it seemed like, what could a dietitian even do? And then you're totally right. Once you start just sitting with people and talking to them about food and about how they approach it, you realize, oh, if I really want to actually help people, I need to be informed about when this gets real rigid and obsessive, because so many people, with really good intentions, just trying to be healthy and take good care of themselves, end up in that really disordered space. So, and then, just like you described, I fell in love with it too. And it's so much fun and it's so rewarding and hard in so many ways. But yeah, I agree. It's interesting to talk to someone who didn't necessarily like set out to do this, because a lot of people, it's kind of like that's such a part of their story that then it becomes part of like what they know they want to do professionally.
Yeah, absolutely. And I started off, I started off more really, really passionate about like quote unquote real food, like whatever that even means now. Like Michael Pollan's work, I was really passionate about. I was really passionate about getting people to not eat diet food and these sorts of things. And I just hadn't been exposed to the philosophies I practice under now, which are intuitive eating, health at every size. And really, no matter if I'm working with somebody with cardiovascular disease or somebody with an eating disorder, that is definitely the framework that I work from. And so, yeah, so I was in my own professional process and really came out of my internship thinking I was going to, for lack of a better word, because you know that there is a lot of conversation to be had around the word obesity, but I thought ultimately my mission was to really help people, not become obese. And I say that with such cringing in my voice because I was so just underinformed and really miseducated. And that was really what I thought I was going to do. I really truly wanted people to get healthier, but I didn't really know what framework to go about that in. And it wasn't until about 2 years after I started my dietetic practice that I really started getting exposed to all the research around weight loss, weight stigma, and I'm sure Steph will jump into today to an extent. And so, so I went through my own professional process as well to get here. And like you said, what I love most about working with women and with eating disorders or disordered eating, and honestly, this is not a real statistic. I'm just putting this number out there. Most of us in the 90 percentile probably are on the spectrum of disordered eating to full-blown eating disorder, whether that's just dabbling in a little bit of diet culture, a little bit of restriction in dieting, weighing yourself, or, full-blown eating disorder that really incapacitates you. I think that this is all relatable to so many people because as dietitians are really trained with a lot of diet culture, as nurses and as physicians. So I think what I found most rewarding, like you said, about the work too, is obviously building meaningful relationships, but just the challenge of the work. It is so challenging, and I've never found a profession or a field where I feel like I feel like I'm always learning and growing and learning something new. It's actually quite humbling, but very challenging.
Very true. So a few thoughts. If anyone's listening and they've never heard of the term weight stigma, or if they're interested to know more about what you were talking about when you said you were exposed to the like the weight loss research and kind of questioning some of the premises that many of us have, or most of us have, about weight and weight loss, I have 2 really good episodes about each of those topics. So episode 113 is with Ashley Bennett exploring weight stigma, and then episode 111 is called Breaking Down Weight Science with Fiona Willer, and both of them are academics and explain some of the science behind those concepts in such a down-to-earth and practical way. So if anyone's interested in diving into that, if you're like, what is she talking about? That might be a helpful resource. I also wanted to mention, Robyn, I think that this is really important. I get a lot of feedback about this from listeners and other dietitians who I work with for like mentoring or supervision. People will tell me so often, like, I'm ashamed of my process, or people are mad at me that I've changed my mind or that I've evolved throughout my professional career. And you mentioned that you were exposed to these things after you started practicing, and that you've changed throughout the years. Me too. I mean, and I, with this podcast, I'm so lucky to be able to sit down with so many incredible thinkers and researchers and people doing amazing work. And I just kind of like to think about it like, how am I not supposed to change doing that work? Like how, and how is anyone who sits with people who are struggling and, really hears their story and really dives deep into what it's like to be human, like how do you not change and grow and learn? Like, I think you just do. I think that's just part of it.
Absolutely. And honestly, I can't imagine being in a healthcare profession, no matter what. I'm a nurse and a dietitian, nurse practitioner and dietitian, but whether you're a physician, physical therapist, whatever it might be, I can't imagine being that profession and not changing. And I think that I had one preceptor during my nursing training tell me in a rotation, it was actually during my BSN year as I was, pursuing my RN, not my NP. And I was in a psychiatric rotation, and he was a nurse practitioner, and he said, the moment you think you know anything, you absolutely know nothing. And it has stuck with me to this day, because I think the more we can just stay humble, and the more we can just stay, obviously, you want to be confident in your work, and you want to portray that message to people just so, for trust and all kinds of things, right? You don't want to be uncertain when you're doing things, but also you're human. And I think if we can come at our work and with a very humble posture, and one that is open, and one that is wants to dialogue through differing opinions, I just think that is going to make you such a much more amazing clinician, because you're open to continuing to learn, and you're open to saying, hey, I made a mistake. And so I think that that's been something that I've actually learned a lot just through supervision and talking with other clinicians and stuff. And obviously being human in practice, I mean, there's mistakes I've made in nursing, there's mistakes I've made as a dietitian, and to bring those to the table and to really have honest and brave dialogue with other people, there is so much learning and growth to be had. And so I would just encourage anyone listening that, hey, if what you're doing resonates, or if it doesn't resonate, like, that is okay. You are human. You are allowed to change. And I think that's actually a sticking point that we have in healthcare these days, is that it's a highly vulnerable place to say, hey, I may have been doing something wrong all along. Highly vulnerable place. And I think that if we could have a lot more open conversation and a lot more openness to saying, hey, I've been going the wrong direction and I want to turn a different way. How do I do that? We would just be able to provide a lot better healthcare.
I agree.
And I'll give an example. My first year and a half as a dietitian, I was in charge. I worked at it was a clinic run by 2 Western trained doctors, but it was more functional alternative medicine. And we ran, I worked with an endocrinologist, so I learned a ton about hormones. This is really what was the catalyst for just my fascination with endocrinology. So I was learning a lot about cortisol and stress and sleep and the impact that has on metabolism and one's own, physical health in terms of inflammation and all of that stuff. I know inflammation is a super trendy word, but all that to say, I ran this wellness group, and at first it was co-ed, and then my second group was 12 women, and I did it with a health coach who was 65, used to be a physician's assistant. She's incredible when it comes to just dialoguing around mindfulness and goals. I learned so much from her. I'm like a deer in headlights, 23, new dietitian. I don't even know how to have conversations like this around people's emotional, mental health, around food. It was quite eye-opening for me. And in that, it was that wellness group with these 12 women, and overall the theme of their histories of food was chronic dieting, yo-yo dieting, up and down weight. Many of them, actually all of them, lived in larger bodies since this was marketed as a weight loss program. But that group really came anything but the goal of weight loss by the end. But I will say I cringe every single time I think about this, because I think about the shame and guilt that I was perpetuating when we weighed them before every meeting. And these were the loveliest women, and they were so kind to me. I can't even believe they listened to a 23-year-old. But I cringe when I think about weighing them before those sessions. And so if I say that to say I've been there, and it's okay if you have to. We're all human.
Absolutely.
So I'm just going to throw that out there.
No, I love that. And my one comment I wanted to make is I wondered if you've ever heard of this psychological effect. It's called the Dunning-Kruger effect. And you haven't? Okay. So
No.
let me explain to you what it is. Once someone taught it to me, I was like, oh, okay, yeah, I see that everywhere. And I've been guilty of that myself too. So what it is it's this cognitive bias where people who don't really know a lot think that they know all the answers. And then the people who actually have spent years and years in that field or in that work or in that research or whatever it is, they're the ones that will say, I don't know anything. And now I have more questions than answers. And it's this really fascinating phenomenon that goes on. I think about like the family dinner table where maybe Thanksgiving or something, where Uncle Jack or whatever is going on and on about some topic maybe within, how about nutrition? We'll just say on and on about nutrition, saying, well, if people just would eat less and exercise more, blah, like here's all the answers. Let me just explain it to you, lowly people. And then here you are as a trained dietitian, you're just like, oh, face palm. Like, it's not,
Yes.
it's not that easy. So anyway, that's one of those things that I think happens to us when we're inexperienced, we're young, and we're like, yeah, I'm right out of school, or even in school, and we're like, yeah, I have all the answers. I'm going to go save the world. And then you start working and you get just like totally humbled, like, okay, let's take this down a notch and let's just admit that I don't really know anything.
I mean, I've never heard of that, but I can't think of something that illustrates my experience more.
Yeah, for sure. Me too.
Totally.
Honestly. Yeah. It's an interesting thing. And I always, I see it a lot just in regular life. So anyway, so you talked a little bit about the experience you had as a young dietitian, kind of being mentored and supervised by, was it an endocrinologist? Is that right?
Yes. Yep. He was a chief of endocrinology at UVA, and was doing a ton of cancer research and vitamin A, and then realized that all the insulin he was giving wasn't really working for people with diabetes. And so he quit working at UVA. UVA is a phenomenal institution. It's where I did my internship, University of Virginia. And he opened up his own clinic about 20 minutes outside Charlottesville, Virginia.
Okay.
And now he does a lot of research on the gut biome and a lot of functional medicine. And I wouldn't say he's totally in line with my philosophy. My philosophy has totally changed a lot since I was there, but also I totally appreciate the therapeutic effect of food and the work that he's doing. So yeah, it's still there. That's where I worked.
So when I first came across you and your work, Robyn, I remember reading something like, I like to talk a lot about women's health and hormones. And like, that's kind of like how I had you in my head. I was like, oh yeah, she's a nurse practitioner and she's a dietitian and she talks about hormones. You talk a lot about amenorrhea as it relates to exercise and eating things. Is this accurate? I'm totally open to being off on some of this.
Yeah. Yeah, I would, totally. So I would say that I talk obviously a lot about hormones. That's kind of, I find it fascinating. And then with that, and we'll probably dive into this later in the podcast, but really endocrinology as it relates to our lifestyle habits. And obviously endocrinology is heavily influenced by lifestyle, but talking about, okay, how do our eating habits affect our hormonal health? How does sleep, how does stress, how does exercise? And with that, you obviously start uncovering a lot of disordered eating and eating disorder habits. And in those behavior patterns, you can get a lot of endocrine manifestations.
Okay,
I guess
great.
is a good way to put
so
it.
let's set the stage here for a minute. Let's talk about like hormones in general and what they are, just for the lay listener who's maybe like, yeah, I kind of know what that is. That's what happens when, once a month or whatever, like maybe beyond just the typical knowledge, like what can go wrong with hormones? How do we kind of broadly care for our hormonal health, I guess, is what I'm asking.
Yeah, honestly, that is a great question. It's a very large question that could cover a lot of land here. But in the simplest way, I'm sure everybody listening has heard the word hormone. When you think of endocrinology, that is a physician who specializes in hormones, essentially. Obviously, I'm watering this down a lot. But essentially, think of hormones as really like messengers. These are the things in your body that float all throughout your body. They travel in the bloodstream. And essentially they speak to different parts of your body. So think of it almost like if you had two cell phones. Hormones are like the signals. So, you're going to have a variety of hormones in your body, like tons and tons and tons of them that affect different bodily systems. And we're going to talk about some of those today. But these are essentially just chemical substances that send messages throughout your body. So there's kind of, they can act in two different ways. They can act locally, and they can also act like more at a distance. So I'm trying to explain this in an easy to understand way, to where they might be made in one part of your body and then they end up traveling to other parts of the body where they can help control how other cells and organs do their work at a distance place. Does that make sense?
Yeah, for sure. And
So
they're involved in, like you already mentioned this, but just to kind of reiterate, like they're involved in pretty much every aspect of how we care for ourselves. So sleep,
yes.
stress, food, obviously like reproduction and sex, some of the most
Yes.
kind of like basic things that human beings need to survive and for our species to survive. Hormones are involved in regulating those things, sending us cues, sending us signals, and regulating just the overall function of our body. Is that a fair kind of thing to say?
Yeah, absolutely. Because you think about it, you have all these organs and bodily systems, but if they can't communicate with each other, you're not going to be able to function.
Exactly. I love that.
Yeah.
That's a good way to describe it.
Yep.
So,
Absolutely.
so in my practice as a dietitian, I see a lot of hormonal dysfunction and dysregulation, typically secondary to like a lot of struggles with food or over exercising or some aspect of self-care being really out of whack. So a lot of times I think conversations about hormones can seem kind of scary, where it's like, oh, medications and these, elusive, kind of confusing chemicals inside of my body called hormones, they scare me, or they, but really I like to bring it down to earth and just be like, this is just, yeah, you might need to have some type of medication on board, perhaps for a certain problem with hormones. But in general, caring for yourself, like getting adequate rest and managing stress and getting enough food and moving your body in a reasonable way, but not too much. All of that can really positively keep hormones in balance and in a good place.
Yes, absolutely. And I think that bouncing off of that and piggybacking off of that, some people might disagree with me. And I obviously, I've learned to kind of preface everything I say with this because I'm speaking in general terms. There are always going to be, more extreme outlying circumstances, always with anything we speak about. And so, but generally speaking, I feel like, especially because hormones is they're such a trendy thing to talk about, trendy like hormone healing protocols and all this stuff we see in the wellness realm.
There is a lot of that. Yeah, totally.
So much of that, that I feel like it creates a lot of unnecessary fear and a lot of unnecessary drama around hormonal health. Because don't get me wrong, there are always, more extreme, serious circumstances. But generally speaking, when people are like, my hormones are out of balance, they're really out of whack, this isn't really a bunch of rocket science or really, extreme diet you need to be on or extreme supplements or things like this. And it's really, like you mentioned, let's just get back to these basics, because hormones are not very easy to measure in the blood. So there's not, and I know that there's a lot of trendy tests you can buy online, and I think that naturopathic doctors can be really phenomenal, but there's a lot of tests that are stirring around in the industry that aren't really well researched. And so it can create just a lot of mental noise around your hormones.
Which ironically is not good for your hormone health or your overall health, right?
Very psychologically distressing.
Yes.
It's so
which in turn can affect your hormones.
Yeah, I mean, stress is the number one thing that affects your hormones. And so I don't know if that's in the literature. That is my own anecdotal conclusion. And actually it is in the literature because cortisol has profound effects on every bodily system. But yeah, I feel like this is just such an important topic to talk about in a very realistic, grounded way. So people walk away feeling empowered and feel, a greater sense of self-efficacy. They don't walk away feeling paralyzed with information and with solutions or fixes, quote unquote, that feel totally overwhelming.
Yeah.
And expensive.
I love that. Okay, so let's dive in. So people listening to this podcast in general are interested in, health generally, and then also obviously food and nutrition. So let's talk a little bit about how does, like maybe broadly and generally, how does food and our relationship with it affect hormones? And I know that's a really, really huge question, but like, let's just talk generally and then we'll go from there.
Yeah. So you're right. This is a big topic, and I hope that we can cover it. Paige, you're phenomenal at, what's the right word? Leading these podcasts, mediating them. So I know we'll totally get there. But I think a good thing to think about, and this is, honestly, this is a very simple way to think about it. And I've been thinking about how do you explain this in a way that is really helpful for people listening and it's easy to digest. But a few main things to think about are kind of three different axes. I think that's a word, the plural for axis, in the body. And a lot of this originates in your brain's hypothalamus, which is a gland about the size of an almond. And it plays you would think it's so small, but it has a large role to play in your body. And so you have a few axes. Is that a word? Am I saying that right? I'm like sitting here second guessing.
I know. I never know how to say like biases and analyses. Yeah.
I think it's axes, maybe. Axes. Anyways.
Axes? Is it axes?
Maybe? You guys know what I mean.
Okay. Someone will send me an email and tell me what the right way to say that is. But
we're always
it's okay.
learning.
We mispronounce words on this podcast. It happens.
Yes, we are always learning. So there's three different ones, and obviously this is not the end all be all. I'm just trying to explain it in a simple way. But you have your hypothalamic, which is your hypothalamus, that then speaks to your pituitary gland, that sits right below the hypothalamus, and then that speaks to your thyroid. So you have your HPT axis. You also have your HPA, which is something that food has a heavy influence on, as does all your other lifestyle habits. That is your HPA axis, which is hypothalamus, which connects to your pituitary gland again, which then connects to your adrenal glands, which actually sit atop your kidneys. And then you also have an HPG axis, which really directs reproduction. And that is your hypothalamus, again, connecting to your pituitary gland, which then spills down to your gonads. And for women, that would be ovaries. So I think of by this into these three systems. Obviously, there's so much more to endocrinology, but I'm just trying to think of an easy way to speak about this. Obviously, two other things that are heavily influenced by food intake, and I'm sure many people have heard these, are ghrelin and leptin. Ghrelin is essentially a hormone that is produced in your stomach, like the lining of your stomach. And ghrelin essentially says, it's a short-term, regulator. And it's basically saying like, hey, I'm hungry. When are you going to give me food? So your stomach makes ghrelin when it's empty. And so when we're not, let's say we get really hungry, that's when you're going to sense ghrelin, or that's when ghrelin's going to be firing. And this is where dieting comes in, and dieting really messes with ghrelin and leptin. I'll get to leptin in a second. But essentially, whenever we're restricting food, and whenever we're not eating enough, even macronutrients, which are carbs, proteins, and fats, we're going to see an increase in ghrelin. Now, leptin is on the other side of that, and leptin is actually produced primarily by our fat cells, secreted primarily by our fat cells, and leptin actually decreases hunger. Leptin is that regulator that goes in and says, hey, we have enough energy on board. I'm satiated I'm satiated now. I don't want to say satisfied, but I'm satiated with energy. So those are two other hormones that really play a profound role, and they show up a lot when we speak about the underlying, hormonal pathophysiology that occurs in the presence of dieting, eating disorders, anything that has to do with controlling food. Does that help give us a good beginning page?
Totally. And just to really simply summarize, I think it's important for everybody listening to recognize that hunger and fullness in our bodies are actually hormonal. It's not that simply to say it's just a hormonal process, but they are very much involved in the hormonal system of our body. So
yes.
So just honoring hunger and honoring fullness, like if you're working on paying attention to those cues that your body gives you, that's going to be, a really good thing for your hormone health.
Absolutely. So, your hunger and fullness is really hormonally mediated. And then you can have, other hormones that come into play that then affect your hunger and fullness signals. And one of the main ones is cortisol, right? Stress has a multitude of effects, from blood sugar to, us being able to sense our hunger and fullness cues. And so there's a lot going on here. It's kind of like a hormonal frat party. And so, of course, I think that what you just pointed out is so important to remember, that simply by being able to, and this is really hard for people, and a lot of people listening are probably like that, I don't even know how to begin to do that, but simply attuning to your hunger and fullness can do wonders for your hormonal health.
Absolutely. And I think that a lot of people don't realize that, like, there's consequences to ignoring hunger. I mean, obviously our bodies are equipped to be able to handle like a day where you just get really busy and things get out of hand. And it's not like you need to be 100% perfect at this. And we know our bodies know how to deal with stuff that comes up. But if it's chronically like not satisfying that basic bodily need of feeding yourself, or chronically not getting to that full, nice, satisfied level, or getting way too stuffed every single time you eat, whatever is going on, like that's not just like, well, whatever, that just happened. I mean, it's good to move on if again, there's so much nuance and it's hard to talk about this stuff without affecting or bothering someone. But I guess the main point of what I'm trying to say is, like, there's consequences to chronically ignoring our bodily cues. And it's not just like, oh, it's fine, I don't really need to eat when I'm hungry. It's like, yeah, you actually do, because it sets off this whole cascade of like all of these things that are put into place in your physiology to get you to eat, because eating is one of the most very basic things we need to do.
Yes. And what I just mentioned, with the HPA axis, the one that connects your hypothalamus to your pituitary gland to your adrenals that sit atop your kidneys, that is highly affected by our fight or flight system. And so everyone's probably familiar with that, your sympathetic nervous system. It is the opposite of your parasympathetic nervous system, which is your rest and digest system, which is a whole nother conversation about digestive health. But when you ignore hunger cues, or you go long periods without eating, and a multitude of factors affects this axis, but since we're speaking in the context of food, what will happen is your hypothalamus senses stress. And so when your hypothalamus senses stress, it's going to help you to survive that stressful event. This is how our body survives in the world. And so I'm not going to go through all the hormone names because it'll just end up sounding like mumbo jumbo on the podcast. But I mean, we can if you want me to, of course. But from your hypothalamus, you release a hormone. I'm going to abbreviate it. It's called CRH, that then talks to your pituitary gland. And your pituitary gland releases a hormone called ACTH that swims down to your adrenal glands. And the cortex of your adrenal glands, you have their cortex in your medulla, but the cortex is going to release glucocorticoids. And to keep this really simple, one of those main glucocorticoids is cortisol. And I'm sure many of us have heard of that, and that has a lot of metabolic effects on the body.
Let's talk about those.
Yeah, absolutely. And so this is where I really talk to people about, okay, this is what's happening. And one more thing, and then let's talk about the effects of cortisol, is like you said, when this builds up chronically. So I'm not saying that we should never have stress in our lives. That's 100% unavoidable. And telling someone to live a stress-free life is like telling them to jump to the moon. It just doesn't happen. So really the key is to say here, okay, those one-off things happen. Let's say you don't eat for a while, or, you're in a really stressful week at work. Like, our bodies can deal with that. It's just, are we coupling that with enough rest or enough of a recovery period so our body doesn't build up chronic stress and then not know how to function? So I think that's really important to know. I don't want people to walk away here thinking I can never have stress again in my life. It's just, are we able to kind of couple that with recovery and nourishment and things that our body really needs to be able to function optimally. So in terms of the metabolic effects of cortisol, I think that this is always such a great empowering point for people to think about, because we don't actually think about the actual pathophysiology that results from stress, because we don't see it immediately, right? So especially when we think about weight, we might feel our body change, but we're not going to feel like our insulin, we're not going to feel ourselves becoming more insulin resistant, if that makes sense. So it's a little bit less tangible for us. So anyways, when we think about the metabolic effects of cortisol, there are lots and lots of them. And these range all the way from, a woman's reproductive health all the way to our cardiovascular health. So they're vast. So I'm going to explain this pretty simply. And then Paige, we can also open up the conversation and you can guide with more questions and things like that.
Perfect. Sounds great.
But, yeah, absolutely. So essentially cortisol goes in and it's going to affect multiple body systems. And so insulin is a hormone, of course. So I just want to mention that. But cortisol goes in and it affects blood sugar because it makes it really difficult, or makes it harder for your body to regulate blood sugar. So you might get, over time, of course, this isn't a one-off event, but over time, you could end up with insulin resistance, which obviously plays a role in diabetes, PCOS, hypertension, cardiovascular disease. Like I mentioned earlier, cortisol can also just dysregulate our appetite. So it makes it harder to attune to those physical hunger cues. So obviously cortisol affects your immune system. Cortisol goes in and suppresses your immune system. So that's going to, cause a whole host of issues. And you also have, like I talked about earlier, right? If your fight or flight system is being activated, then your rest and digest parasympathetic nervous system is not going to be working. You can't have both of them going on at the same time. And so if you have all of this stress going on, really your body is not doing a good job at digestion. And so that's why when we talk about digestive issues, and I know that you've had the amazing Marcy Evans on your podcast too to talk about this. I think that episode's phenomenal. I don't know what number it's is.
So 81. I actually happen to know that off the top of my head. So if anyone,
fantastic.
Yeah, that's a good one.
Yes. So if this is resonating with you, go listen to that episode. And this is why we talk about, psychological health when it comes to GI issues, because it plays such a profound role. And this is just one of the ways, the gut-brain connection is really well established in the research and we know a lot about it. But all that to say, lots of cortisol is going to suppress your rest and digest parasympathetic nervous system, leading to some GI issues. Cardiovascularly, actually, psychological distress is one of the leading risk factors for cardiovascular disease. But really, lots of cortisol built up over time, chronic levels, of course, can lead to, constricted blood vessels. Your blood pressure gets elevated, and over time, you're going to have some vascular damage. And obviously, that's not good for your heart. Like we mentioned earlier, fertility, which plays into that HPG access. So this is especially for women. You mentioned amenorrhea, which for those that are listening and they're like, ameno what? I'm so sorry. There's a dog barking outside for anybody listening. So for you guys that are like, ameno what? Essentially that means that a woman loses her period. And again, there are many, many variations of this, but we're talking about really somebody who's had a menstrual cycle pretty regularly, and then they lose their menstrual cycle. They don't get a period for at least 3 months. So longer than 3 months, they're not cycling. One of the causes, and one of the main actually diagnoses, is what we call hypothalamic amenorrhea. And that just means that your hypothalamus isn't functioning like it should. And so that really causes problems down the line with your ovaries' ability to produce progesterone and estrogen.
Okay, so I definitely want to dive into amenorrhea, but I want to talk about some of the things you said first, and then let's dive into that one a little bit more specifically.
Totally. And then let me mention one more thing with cortisol, because I know it's a hot topic for people, and that's thyroid health.
Yep, go for it.
And that is that cortisol can really disrupt your thyroid health. It messes with your body's ability to convert T4, which people probably heard about, to T3. So that's just one other thing I want to just bop in there, because I know thyroid health is a hot topic in the wellness world.
Perfect. Okay, so I'm sensitive to people listening feeling like, well, Robyn and Paige are just saying that if I have cardiovascular disease, or if I have a thyroid problem, or if I'm struggling with some hormone-related thing in my health, that it's all just my fault and I'm not living the right lifestyle. So let's just address that before anyone has that thought.
I love that you brought that up. I totally love that you brought that up. And so everybody listening, I hope that the message that comes across is this could just be one piece of the puzzle. So there are many, many pieces of the puzzle here. Genetics play a profound role in our health. There are so many things about our health that we actually have zero control over. Genetics, oppression, socioeconomic status, race and ethnicity. I mean, so many things. And so all that to say, this, I hope, is a conversation just to say, maybe it's not always about the food. Maybe it's not always about exercise. Medication certainly play a role in all of this. There's a lot of pieces around here. So I'm so glad you bring this up, Paige. And I really want this just to be a conversation where we can open it up and say, okay, can we kind of broaden our scope of just the impact on our whole health and how that affects hormones versus what we sometimes muddle it down to is just food and just supplements.
Perfect. And I love the visual of this is a puzzle piece. This is something to consider as you're looking for, answers, or as you're trying to figure out how to care for yourself in a way that's really functional and positive for you. I think it's just really valuable to have, as many puzzle pieces as possible so that you can look at it in a zoomed out way rather than just, like you said, kind of being hyper focused on, well, if I just eat the exact right foods and if I exercise the exact right amount or in the exact right way, then I'll be so healthy. I think, I mean, really what the vision of the whole reason I do the podcast is to help broaden people's perspective of what health looks like and talk about what really matters. And for sure, nutrition is part of it, but it's not the whole picture. So no one here is trying to blame you like, well, you just didn't relax enough and that's why you have cardiovascular disease or whatever. It's like, there are elements of things that are just out of our control. But okay, I love it.
And I think that that certainly, that I just think that it's really important just to consider that there's so many moving parts here, and this is just one of them. And I hope that what I want people to hear too when it comes to hormonal health is there's no quick fix. And if somebody tells you they're a quick fix, that's a really just really compelling lie. Red flag, because you're not going to arrive at a place with your hormones and be like, everything is clicked into place like you would with a cast healing a broken bone. This is about you on this continual journey of figuring out how to best care for yourself in a sustainable way that feels good to your body. And so this is going to ebb and flow. It's going to be a process. And instead of thinking of it as like, I want to fix my hormones, whatever that even actually means, is almost just to see it as like, I want to learn to take care of myself. Because I think that if we're just focusing on eating a certain way and taking supplements and hoping everything gets fixed, we're actually going to end up really frustrated and stressed out.
Yeah. Love it. Okay, perfect. So one of the big topics that I think might be really interesting to people listening is this topic of amenorrhea. And again, that just means being without your period after you've already had a period established for, I don't know what the criteria is, but for a while. And then all of a sudden you don't have a period for at least 3 months. That would be considered amenorrhea. And correct me if I'm wrong on any of that definition. But I think that this is interesting on a lot of different levels. First of all, I know you talk about this a lot, Robyn, and I see this in my office a lot, but a lot of my clients will say, oh yeah, I don't have a period and my doctor said it wasn't a big deal. And then I do an assessment and I realize, oh my gosh, this person, maybe they present at a quote normal, considered, normal BMI or whatever it might be. So maybe it flies under the radar and the doctor doesn't think it's a big deal, or the medical provider says, it's okay. You just exercise a lot. I think a lot of people who have dabbled into diets or have struggled with disordered eating or over-exercising or a lot of, anywhere in between, I think a lot of people have had this experience, and then it just gets brushed off by the medical provider as not a big deal. What's your reaction to that?
Yeah, my reaction is, it's frustration mixed with also some empathy too, because amenorrhea is not something you're going to fix. So first of all, amenorrhea is not it's not like a disease. It's a symptom. And so unless you can figure out what the underlying cause is, you're never going to be able to resolve the symptom. And so that's essentially what is a symptom. And so I think that's really important to understand. And like you were saying, when you do an assessment, how clients present to you, that almost gives you more information to ask further questions to figure out what's really going on underneath that. It doesn't just stop there. So I think that I say frustration also coupled with empathy, because in my nursing training, I went to a school that's pretty well known for their education, and I didn't get a lot of training around this, maybe an hour in a lecture. And doctors, I'm assuming in medical school, I've never been to medical school, probably don't get a lot of training either. And so it's not something that's on our radar as much as like cardiovascular disease, right? I had like multiple classes devoted to that. So I say that not to give an excuse. We should know about these things. We should be looking for them. We should be reading the research. But to say too, like, there's some brokenness in our education system, and we don't see the immediate effects of amenorrhea. We don't see because it affects multiple bodily systems.
Well, obviously, and there's a general thing in the medical field of sort of a fear, I don't know if that's the right word, or a hesitation to even get involved with any type of like disordered eating or eating disorders.
Yes.
Like medical providers are like, whoa, that's scary. I don't even want to go there, and I'm going to refer out a lot of times.
Yeah.
At least that's what I see in my community. So, so that's another element that I think it's important for the average person to understand is maybe there's a lack of training, and there's also like a feeling of like, I'm not qualified to even go there. That's scary.
Yeah, you just hit the nail on the head. And so that's another piece of that empathy to say, along with amenorrhea, you don't really get any eating disorder training in nursing school. And I know you don't get it in medical school either, from talking to other people who've been medically trained. And so the same way you're coming in feeling anxious and sometimes at a doctor's appointment, when a doctor feels like, or a nurse practitioner or physician's assistant feels like they're not well equipped to deal with and have that dialogue around eating habits and some disordered eating, or around your mental health and your relationship with food in your body, they feel really awkward and uncertain too. And so the best way to deal with that is to kind of divert. And so unfortunately, I just have a little bit of empathy, because if you're not familiar with this stuff and this language and these conversations, it does feel really unfamiliar, rocky, shaky ground, and you don't feel that confident in it like you would perhaps talking about cardiovascular disease. So amazing point to bring up, Paige.
Well, and I'm glad that you brought up the empathy, and I feel the same way. I think that it's really important for, when we point out a criticism of our own field, of other practitioners, I just think it's really important to like give credit where credit's due. Like it's hard to know every single thing, and there's real gaps.
Absolutely. And just because I know a lot about amenorrhea because I've spent years researching it, that by no means that I know half of what a well-trained physician knows. So not at all. So I think that we all kind of have to work together. I've worked a lot with a lot of physicians. They are brilliant people who have a depth of knowledge that I do not about many things. And so, this is where it comes back to staying humble and always wanting to learn, that I'm going to learn a ton from other providers all the time. I'm actually pretty young in my nursing profession. And therefore, hopefully they're going to be open. I worked with a phenomenal physician in New York City at my job. And he loved to discuss with me these kinds of things. And it was such a wonderful, just like collaborative relationship, because I was learning a ton. And I also felt like I could teach him some things too that made me feel like, oh, this feels really nice, not to just always be on the learning end.
Right. Yeah, for sure. So, we all have stuff to teach each other, yes, including our patients and clients.
Yep, absolutely. Could not be more true.
Okay, so we've established it's a problem to have,
yes,
to not have a menstrual cycle. That's not just not a big deal.
Yes. So there are two. I do think it's really important to. There's two types of amenorrhea. There's primary and then there's secondary. Typically, what we're going to talk about today is secondary because that's way more common. Primary is not very common. And it's typically the result of like a genetic or anatomic condition in young adolescent females who have not ever developed a period by the time they're 16. Now, sometimes you can have a primary amenorrhea that really has a clinical picture of secondary. So you just haven't gotten your cycle because maybe you have an eating disorder or maybe you exercise a lot. So there is, some variation there. But we're mainly going to be talking about secondary amenorrhea, which is really a dysfunction. It's for multiple reasons. Pregnancy is obviously a very normal reason for amenorrhea, but this occurs like you were saying, if you have not had a period for at least 3 menstrual cycles, then obviously you can't just diagnose based on that alone, but that really raises a flag to say, okay, some more explanation needs to be happening to get a diagnosis here.
Okay, perfect. And so let's say someone listening has this in their history, or they're going through it right now, or they have a loved one who is struggling with this. Like, what do you do? Like, I mean, I know that it's different if it's been 3 cycles versus 3 years versus 3 decades, right? So I know that there's a lot of different ways this can look, but just in general, and you can just give advice very broadly, or even say, like, go see your doctor and get some medical care.
Yeah.
But what I know that you work with women about this. So what are some of the things that you advise people to start off with?
Yeah, I think starting one, I do want to say, of course, like going and getting an official diagnosis can be really helpful and empowering. And it can also take a long time, because amenorrhea, hypothalamic amenorrhea, which is really what we're mainly talking about here, and what most people are going to resonate with, and what most people actually suffer from, is a diagnosis of exclusion. And so we don't like diagnose based on meeting certain criteria. It's like IBS. You diagnose based on ruling everything else out. So I do want to say that, yes, I would suggest you go see your primary care provider, and they can run some tests. And I can give some suggestions onto, like, if you walked in and saw me, what labs we'd be running. But also, if what we're talking about here resonates with you, you have a history of weight loss, dieting, excessive exercise, rigid eating habits, high stress, and that really resonates with you, and you haven't gotten a cycle for more than 3 months, the chances are, I would, again, go talk to your doctor. But if you have a history that really lines up with this clinical picture, chances are you're probably suffering from hypothalamic amenorrhea. So I don't say that. Please don't take that as a blanket diagnosis. But I just don't want to prevent people from making changes in their lives just because they haven't gotten an exact diagnosis. Does that make sense?
Yeah, that's great.
So one of the first steps you can do is to go see your primary care provider and tell them about your story. What they should be getting is a very detailed history of your menstrual function, your eating habits, exercise habits, all that stuff. And if they don't ask, I would encourage you to share as well. I know that can be a vulnerable place and hard to share that with somebody you may not know that well, but a doctor can only help you as much as they know. And so that can be really helpful. They'll do a physical exam to be looking for there's not really a lot of physical signs like, that we would hear, like, a heartbeat obviously can tell us if there's a suspected heart murmur or not. But a physical exam is still really, really important, especially for ruling out other diagnoses. And then they would draw some lab work, and a beginning lab work that they're going to draw is they're going to draw really a female hormone panel. What I would draw if you came and saw me would be an estradiol, which really actually isn't even the most significant lab. So if you don't get that drawn, like, it's not the end of the world. So estrogen, people think that's actually like the most important lab to have, and it's really not. They're going to draw FSH and LH, which stands for follicle stimulating hormone and luteinizing hormone. And those hormones play a very large role in ovulation. And so luteinizing hormone is actually one of the most significant labs we can draw. It gives us a lot of information. And then they're also perhaps going to draw a testosterone level to make sure your testosterone is in good range. That can also tip us off to go further exploring for a diagnosis such as PCOS. And they actually might also draw some thyroid labs because your thyroid can certainly affect your menstrual function. And then they might actually draw a prolactin lab, and I would probably draw that just to make sure your prolactin levels are normal. If you have high prolactin levels, that actually inhibits menstrual function. And certain medications can also raise prolactin levels. So obviously your doctor's going to want to know what medications you're on. Does that give you a good start, Paige?
Perfect.
Do you think that's for people listening?
Mm-hmm. I love that. So a lot of times what this comes down to is adequate nourishment and taking a look at your exercise. Do you want to just speak to that, how that relates to amenorrhea?
Yeah. So, and then before, obviously lab work is kind of the mainstay, but your doctor might also order an ultrasound. And so to take a look at your uterus and your ovaries and all that good stuff. So don't be alarmed if that happens too. Yes. So I think that if we think about what plays into our reproductive health, there's obviously more components to this, but we're talking about the context of lifestyle primarily. I think about it in about 4 prongs. And there's a little 5th prong called genetics that we can't control. So that's always really important to keep in mind. Genetics always play a role in almost everything. And so those are things we can't control, unfortunately. But the 4 other things are really, when we think about this, we think about stress. And when I say stress, I really am talking about perceived stress here, like psychological stress. So there's that. There is sleep, your sleep patterns. I think about that. I think about your movement and your exercise, and I think about the way you're nourishing yourself. One thing that's important as a part of your history, it's not necessarily lifestyle, it ties into all of these, is if you have any sort of weight loss history. As little as 10 to 15 pounds is enough to, a fluctuation in that in your history is enough to really mess with that HPG axis. Also your thyroid health as well, and that can really alter your reproductive function.
Perfect. So, like, what I see a lot in my office is people who, like women, I guess, we're talking about women here, women who know that they need to be eating more. Like, I'll just be frank, like they need to be eating more and they need to be exercising less. But and they want their period back and they want this health, and they know that it's like not good that they're not getting their period, and that's a sign that their body's kind of not in a very healthy place. But there's so much psychological stuff that can get in the way of being able to like cross that barrier.
Yes. Oh my gosh. Yes. And so I think that's where things get sticky too, when your doctor's trying to help, but they don't really know how to help. And really, quite frankly, they don't really have, unfortunately, they're not given the time to really give this conversation just the space it deserves. And so oftentimes it's just not as easy as saying eat more and exercise less. And this is really the hard space for people, is to say, okay, am I willing to care for my body and tolerate? I'm not saying you have to accept it or that you have to love it or like it, but am I willing to tolerate the idea of my body changing? And am I willing to tolerate and respect its natural body size?
That's huge. That's huge. And that gets in the way so often.
Yes, absolutely. And so the amount of just values work and talking and dialoguing through this stuff and beliefs that we do in this process of actual physical healing is quite significant. And I always tell clients and patients when we're working together, this is about so much more than you getting your cycle back. And this is about so much more than your reproductive health. This is about also your relationship with food, your relationship with exercise, your relationship with your body, and, ultimately really your relationship with yourself.
That is so profound. And like I think that's kind of what I love about talking about all this stuff, is on the surface you think like, oh, we're talking about periods, or we're talking about hormones, or we're talking about food, but really it's so much more than that. It's the way we care for ourselves or don't, or struggle with these things, can just be so core and deep. And so I love what you just said. It's a big deal.
Yeah, and that's why I think I was actually doing a podcast at one point, and we were talking about this, and I think this is why just being able to utilize all the different professions in healthcare is so effective when it comes to this stuff, whether it's, a diabetes diagnosis or an autoimmune disease or something like hypothalamic amenorrhea. A doctor is not necessarily going to be able to provide all the support you need. And so being able to, have a registered dietitian on board who's really knowledgeable, perhaps there's a therapist, perhaps there's all kinds of other, treatment modalities that we can pull from to really help, because it's never just about eat this and not that. There is always underlying things there. And I was just exposed, and like, oh my gosh, my eyes were as big as the moon during this wellness program, years back I was talking about with these women, is I was just sitting here thinking, oh my gosh, there's so much, like deep heart and soul complexity here
Yeah.
that we cannot heal this surface issue unless we really get in there and heal what is underneath.
Absolutely. That's
Yeah.
so true. Okay, so I feel like this topic of hormones is huge, and I know that, one can devote an entire career to even talking about one hormone. So I recognize that maybe some of my questions are a little bit bigger than they should be, but I want to just take a minute because I'm sensitive for someone listening if they're like, oh, they're just talking about women during reproductive years or even just about women. So really quickly, will you speak to men and men's hormones specifically? And then will you also speak a little bit about menopause?
Yes. So I'm going to speak more briefly to men's hormones because it is not my bread and butter. So I would, just being completely transparent here. But I think it's important to recognize that men, and so when we think about estrogen in women, we think about men and testosterone. And so these same things we're speaking of with women, exercise, nutrition, stress, sleep, etc., those are going to affect men in the same capacity. Of course, men don't have menstrual cycles, but men's bone health, men's sex drive, all of this, and men definitely have estrogen too in their bodies, it's just not their dominant hormone. They're ultimately, these are affecting them in the same way.
And so the stuff you talked about with cortisol and the stuff you talked about with cardiovascular health and insulin and all of that stuff, and hunger and fullness, that's all completely relevant across genders.
Absolutely. Thank you so much for pointing that out. I tend to get in my female lane because that's what I'm so used to.
Totally.
But absolutely. All of this pathophysiology spans across all genders. And when we're talking about reproductive health in women, men certainly have a reproductive system as well. And so I can't speak to the specifics in the same way in males as I can to females.
Yeah, that's fair.
But absolutely, you're going to see an effect, low testosterone levels for men, which have a ton of, manifestations for men that are affected by lifestyle.
And you're going to see consequences to dieting, restriction, eating disorders, things like that, like physiologically and hormonally in men as well.
Yep, absolutely. Yeah. So men have an HPT. They have that access that connects to your thyroid. They have an HPA that is your stress, access. And they also have an HPG access. Their gonads are just their testes.
So thanks for hitting on that. And then let's just take a minute to kind of talk about menopause.
Yeah, so I think that this is such a topic that gets under talked about, but is so important. And it has been actually my focus to really expand and broaden my knowledge on this to the amount of depth that I feel like I have. And of course, I'm always still learning around premenopausal women. And so as we think about speaking to menopause, is there a specific question you have, Paige, or a point I can start on or something?
Oh, I know. That's such a broad question. I guess I just don't want to leave women out who are in that phase of life. And I know that when that comes up for women, there's a lot of questions about weight, about food, about hormone health, about lifestyle, and a lot. I mean, the things I hear from my clients and my mom, just so much stuff changes, and it can be kind of this lonely time where you expect, society sort of expects you to stay exactly the same, and meanwhile your body's totally changing.
Oh my gosh, yes. And so as we think about that, I think that this is such an important discussion to have. And I think it's important to really pull in the what's going on in your body and why this is happening. And so you're right. Menopause is, of course, when women stop having their menstrual cycle, and really that's caused by, you lose all your follicles on your ovaries, which contain all your eggs. So essentially, when the follicles and the eggs die, your ovaries are no longer secreting your hormones, estrogen and progesterone. And so you don't get a menstrual cycle. And so obviously your hormonal levels drop. And so that's going to cause a lot of symptoms. Women talk about, mood swings and hot flashes and other things that happen. But I think that one of these huge things you're talking about is body changes. And so really what I think is so important to think about is that women's bodies are not supposed, and I say this with just such emphasis, because biologically our bodies are not supposed to stay the same after we have a baby versus pre-baby, and they're not supposed to stay the same before we go through menopause and after we go through menopause. You cannot have the same body biologically, and obviously there's going to be tons of variation in what that change is, but your body is going to experience shifts no matter what. And really most women complain about or feel frustrated or feel shameful, and a lot of this is diet culture, like you mentioned.
Well, exactly. So like we the body is supposed to change. Meanwhile, we live in a world that only centers older or younger women, and when they do center older women, it's older women who have, the exact same body as the 20-year-old. So it's tough to like it's almost like maybe someone listening, this is the first time they've ever even heard someone say your body's supposed to change. Like, it is. You're not supposed to look the same. Yeah.
It is. And I think that we have to be really mindful as dietitians and healthcare providers to be looking out for just symptoms of perhaps some disordered eating behaviors, perhaps some anxiety, depression, a lot of these things. I mean, menopause is a very large transition in a woman's life, and it's a very vulnerable time. And it can be very isolating because you're just supposed to kind of swift through menopause and keep your body the same and stay looking and feeling great. And there's a lot going on there. And so I would just really encourage women that our bodies change because your body stores estrogen and fat. And so when your body is not going to be producing, as much estrogen, or really your estrogen levels are plummeting in menopause, your ovaries are not producing estrogen and progesterone anymore, your body needs a way to hold on to some of it. And so that's why we see shifts in adiposity and women's body shapes and sizes, is because this is your body trying to protect itself and trying to survive for the long haul.
Perfect.
And so if we can almost embrace that in a really compassionate way, and I know this is much easier said than done because we live in a very diet-centric, fat-phobic society, and just realize, hey, can I work with my body and can I continue to take care of myself regardless of how my body shifts and changes? That's a really hard concept. I totally understand that there's some work that might need to be done there, but I think that it would just be a totally different experience for us.
Thank you, Robyn. That's exactly kind of what I was hoping to talk about. Just like basically just saying like it's normal, it's healthy, it's functional for weight and fat to shift in like premenopausal, postmenopausal years. Like this is okay. It's not fun, it's not easy, but it's something that like I think for me with shifts in my own body, with parenthood, with a lot of different phases of life I've been through, just knowing that something is normal, it's like so healing, So I just wanted to take a minute to say that.
Absolutely. There is nothing wrong with you at all. And if anything, your job is to just continue to keep taking care of yourself mentally, emotionally, physically, spiritually, all those good things. Your job is totally not to micromanage your body size. And that's really not important.
And in fact, putting this in context and kind of coming full circle, if menopausal or premenopausal woman is noticing weight shifts and it's freaking her out, and then all of a sudden she starts, restricting and going on diets and getting really stressed about it and over-exercising, that can just make the hormone shift that's happening naturally, like that can really throw things off in a really negative way.
Oh, absolutely. It's almost like I kind of describe it this way, and I don't know if this will resonate with people or not. It's like having everybody drunk at a frat party, and somebody bringing another keg. It's just never going to end well. It will never end well.
It's not going to end well.
I love it. It will not end well. That's how I describe it. Mm-hmm.
So if the menopausal women listening can remember back to college, maybe that will resonate.
Yeah.
Just joking.
Yeah, I think that I would just really encourage a lot of menopausal women to say, instead of focusing on the tangibles, exercise and food, like what if we said, okay, let me really kind of like, I'm thinking about it like women postpartum too, when we have all this focus to get back to, I've never had a baby before, but when we have all this pressure to get back to our pre-baby body, whatever that even means. And in lieu of that, we actually neglect a lot of our mental and emotional health that has such profound effects on our physical health. Same concept as you go into menopause. Like if we can kind of shift the focus and really focus on caring for yourself mentally and emotionally, those tangible pieces are going to fall into place. But I think there needs to be a shifting of focus in those menopausal years.
Oh, I love that. That's such a good way to say that, Robyn. Thank you
Yeah.
so much for sharing all this. This was a good mix between the sciencey side and kind of the emotional, like compassionate side. I think you did a really good job of kind of talking about it from a lot of different angles. So I really appreciate your expertise as a dietitian and a nurse practitioner. That's such a cool background to be able to talk about this topic in a really unique way. So thank you so much.
Yeah. Of course. Thank you so much for having me. And I hope that it was helpful for people listening. Of course, this is like the tip of the iceberg and there's so much ground to cover.
Yeah.
What I hope, if anything, listeners that are listening can kind of just say, oh, hey, that point was really interesting to me. Like maybe I can do some further reading, exploring, things like that. So at least hopefully it's a jumping off point for people. Because of course, like you said, there is so much ground to cover.
There always is, you know?
Yes.
So Robyn, take a minute to tell people about how they can find you and talk about your course and all the things that you offer.
Yeah. So you can find me. I have a private practice called Real Life Women's Health. So just those words, .com. And then I also blog at thereallife-rd.com, and you can find me there as well. I blog a lot about women's wellness, a lot of the topics we discussed today, eating disorders, but really just essentially just kind of taking care of yourself. And I talk a lot about just what it looks like to take care of yourself in a world where diet culture tells you all the external ways or external cues in which you should live by. So you can find me there as well. I am on Instagram. I'm really on Instagram mode. You can maybe find me a little bit on Facebook, but you're not going to find me on Twitter active. And so really, if you want to connect with me, find me on Instagram. It's my favorite social media platform. Twitter's a scary place. Yeah, oh God, Twitter. I don't even know if I know how to log in. But Instagram, I am @thereallife_RD. Of course, I always tell people you're open to emailing me if a blog topic or question you want addressed on the blog. I also do live Q&As on Thursday evenings at 5 p.m. Eastern Standard Time. So that's tonight on Instagram. And that's just a really casual, put a question in the comments and I'll try to answer it the best I can given that platform and circumstance. So those are the best ways to get in touch with me. And then I also, I do have a couple online courses, and I'm hoping to release one here in the next month. I'm awaiting CEU approval from CDR for dietitians, but I have a course on healing your hormones and regaining a healthy period. And this is where, like you mentioned, you can probably Google a lot of information about what you need to do to get your period back, a lot of generic information. And to get a healthy cycle. But what the course is it really compiles all the work I do with clients over multiple sessions, but it's in a more affordable, accessible, self-paced online format. And what I really wanted to do is I wanted to, of course, combine, what's going on in your body and what are the tangible steps, but also a good bit of the course too is saying, okay, how do we really learn to take care of ourselves and how do we learn how to cultivate healthy body image? In the midst of that, like we talked about, because it's never really about just eat this and don't do that. So that's what I hope the course really, really brings home. And that's why I hope it's highly effective for people, is because it is addressing those components that keep people stuck. So all that to say, those are on my website too, private practice website, and you can check those out.
Okay, perfect. Thank you again, Robyn, so much. It was lovely to talk with you today.
Yeah, of course, Paige. Thank you so much for having me. It was a blast.
Well, I sincerely hope you've enjoyed this conversation. If you haven't already, please go ahead and leave a review on iTunes. Thanks again so much for listening, and we'll see you soon for another episode.